COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Welcome, everyone, to one of our most anticipated live casts. And I'll tell you, before even jumping into it, I'll fully admit, Suman, you might back me up on this. I was pretty nervous about this one, knowing that Monica's in the mix.
Nervous.
You know what I mean? I texted the boys. I'm like, I'm actually I'm a little bit.
I'm very excited to be on with all of you.
Oh, well, thank you, Monica. So we'll get into the reasons why we're doing this, but obviously for me, it's about the main thing for me personally was creating hope, guys, because we have a lot of negative messaging out there, a lot of shaming, and a lot of, restrictions that don't make sense to a lot of people. And so I think by creating this kind of discussion on exit strategy, not only are we trying to create that hope, but also maybe pressuring some of these decision makers to see the light. You know what I'm saying? Okay, couple housekeeping things. If you guys want the video sent to you or you want to get the podcast version of this bad boy, type in news, NEWS, into the chat box, and you'll get a prompt to sign up for that. Second thing, Solving Wellness, our new platform for dealing with healthcare provider burnout. We are so proud. We're 2 weeks in. We're at 100 members. If you're interested at all, put in SW in the chat box and you'll get prompted to do that. You got online fitness classes, yoga, cooking classes, nutrition tips, how to manage stress, all on one platform. And I want to give a special shout out to Kelly Ebbs from Kelly and Carrie Realtors, who sponsored 15 memberships for healthcare providers. So those are going to 15 ICU nurses at the Civic. We really wanted to thank Kelly. That's tremendous. Lastly, I want to just thank Julia as usual. She's our social media queen and is going to be fielding some of the questions and moderating some of the questions. So you can find her content. She has a great website on nutrition, A Spoonful of Science. She'll put the links in the chat box. Okay. I feel like all our panelists basically need no introduction. They're not new to the Quadcast at all. Heidi Tworek, Dr. Tworek, communication specialist. We got Dr. Zane Chagla, infectious disease. Dr. Suma Chakrabarti, infectious disease specialist. Yeah, do it. I feel so bad. I can't find my shirt. And then Dr. Monica Gandhi. Y'all don't know how hype that is to have Dr. Gandhi in the mix, y'all. Like y'all don't realize. But yes, this is a true privilege. So thanks everybody for joining. We are going to start with Heidi. Heidi, I gave a little blurb on why I think this live cast is important, but in your mind, why is it important to have this discussion on exit strategy?
I think there's a whole bunch of reasons, but let me start with one, which is the key word of strategy. So much of what we've done throughout this pandemic has all been tactical. It's day by day, and it's made people confused. So often when people have contravened guidelines, it's not through malice, it's through confusion. So what we finally need to do in this hopefully last stage of restrictions, let's finally get a strategy and let's communicate to people. And there are several reasons why strategy is important. Number one, you named it, hope. There's a good 4-letter word rather than a bad 4-letter word. Let's give people hope, because one of the reasons why that matters is helps people hang on for a few more weeks. If we know we're doing something for a couple more weeks and then we're going to be exiting, feel a bit better about it. But also the strategy element is feeling like we can actually get back to a place where we can do some of the things we did in 2019. So that it's not just a sense of, well, we're getting this one thing like outdoors back, so why bother with the vaccine, because things won't really change. So it's also about motivation. And then the final reason that strategy matters is in thinking about building people's confidence in the vaccine and motivating them to get it. If we're tying these things together and say, hey, an exit strategy is here, but it also relies on some of these tools, and look at all the stuff we have to look forward to, and look how quickly it can potentially arrive. So there's a whole host of reasons why it's not just exit, it's also strategy. And that's why I'm really pleased that we're doing this to try and push for that.
I love the point you make about the vaccine hesitancy. I guess because that could not be intuitive to a lot of people. It's like, if you say I get vaccinated and life is not changing, what is my push to get it? You know what I'm saying? And this is such an important point, which I hope our policy decision makers are considering. And, you know, this is something, so Monica, like there's places in the world that have an exit strategy, and you're in California right now. Maybe you could comment on, if you like that California strategy, what is it composed of, or even ideally what you would want to see in an exit strategy?
Yeah, I have been actually pushing for not just California, but for the country, the United States, to come up with clean metrics, just metrics of when things come off over time. Based on hospitalization rates or case rates or vaccination rates, what have you. Because what that does is exactly what you just said, Heidi, is that I think the people who want to get vaccinated, they're fine, they're done. They would get a vaccine even if you didn't kept them in masks and distancing for like 2 years. Like, they wanted to get the vaccine. There are people who are hesitant to get the vaccine, and you're telling them that if you tell them how things change, and you give a glimpse of maybe they're having a pre-pandemic life in their own house, but you can actually go to the movies, or you can go to the theater, or you can, life suddenly opens up, then it's very motivating. And I think that is this positive motivation aspect that we think about in HIV, at least, all the time. It's not always negative and stick, it's carrot, is very important. So I actually, beyond California, I've been talking to national people here saying, let's have some clean metrics. And then they gave some clean metrics last week, the CDC, and people weren't ready, actually, to be honest, with the mask guidance. Boy, were they not ready. But we can go back to that. But I think it is really important. This is the day. So the UK did this, right? Like, the UK said on May 12th, you can have a big wedding. On June 21st, it's all over. This is when we'll take off masks. There was like a roadmap. And so people were like, oh, I'm going to plan my wedding after that. I'm going to do this. Like, it's really motivating. So Canada does, the US came to it late, though. It's not like we had it from the beginning, but it's just starting now, I think. And so California, June 15th, supposedly all restrictions are over. May 20, 2 days from now is when New York is all over, meaning New York, literally the governor said today, biggest state, New York said, we're done as of 2 days from now.
Wow.
They're right. It's the cases are not going to go up. I know people are nervous, but they're right, because the vaccination rate is so high that immunity blows all these other mitigation strategies out of the water. That's what people don't understand. They think if they wear a mask and distance and ventilate, that is just as good as immunity. No, that's like 101, like pathogen pandemics. Like, immunity is how you get out of a pandemic, and we're so lucky to have these vaccines.
Yeah. So, Sumant, you're going to say something?
Yeah, no, first of all, I think that these insights are so good. And, Dr. Gandhi, coming from, you guys were in a long lockdown too. And just to see you guys come out of it has been hope for me. I think the thing, we talked about the messaging. It's so important, I think, also to be positive about it. That doesn't mean that you lie when things are bad. Like, I think that, when the third wave hit here in Canada, it was bad. And you want to be honest about that. But I agree that I'm noticing that when you get a lot of the doomsday messaging, people end up just turning off and they get desensitized to it. And one thing that I think that has concerned me throughout the last well, whatever it is, how many months, 6 months we've had vaccine, is that significant underselling of the vaccine. With our messaging, everything is couched with a but. So for example, we know that the vaccine decreases your chance of getting severely ill, but you should still start wearing a mask, continue wearing a mask. It decreases transmission, but you should still do everything you were doing before. And the thing is, that is exactly what Heidi was saying, is that it just completely makes it seem that life now is not any different. There's no goal to set to look forward to. And you just end up, I think that does make people who are not anti-vaxxer, but vaccine hesitant, they move farther away from the fence.
Zane?
Yeah, I mean, it's funny. When I was thinking about tonight, I was really going back to, that original messaging that I think we came out with in February and March of 2020, and how things kind of got changed so much along the way, right? Like, in February and March of 2020, we didn't know how this thing was going to end. We didn't know that the first vaccines that came to the market would be the most effective vaccines. Our goal in February of 2020, March of 2020, when things went haywire, was to use non-pharmaceutical interventions as a bridge to salvage healthcare, right? That we could just burn the virus. The virus would just burn through the population, but at least we could spare healthcare for, the people that needed it, for the care that needed to be provided, and not overwhelm the system. We hit that, unfortunately, in this wave where we did have a significant amount of healthcare strain, and I think we're recovering from it, which is a thing. But there was, I think, a lot of immature messaging there in January, in March, and April of 2020, really suggesting that our ability to lock down, to close, to push cases to the lowest possible denominator would somehow eliminate this virus, and somehow we go to a COVID-free world at the end of it, right? And I think we're slowly coming to the grips. I mean, me and Suman were talking about this. I think the first article me and Suman even wrote together in July of 2020 was like, no, COVID is not going away. This is an endemic virus. It's reached every corner of the earth. There is no way you're going to be eliminating this, given the viral properties of pre-symptomatic spread, of inability to get tested appropriately, of quarantine, and all those things. But we're doing this as a measure right now until better things come down the pipeline. But better things are down the pipeline, right? Like these vaccines are incredible. And like it or not, they reduce transmission, but they reduce that healthcare burden. That was the original intent of everything that we did, right? The goal was not to eliminate COVID from the face of the earth. The goal was to make sure that COVID became an endemic disease that doesn't drive people into hospitals in droves, doesn't collapse healthcare systems, and is part of our endemic milieu of respiratory viruses that I think myself, Dr. Chakrabarti, Dr. Gandhi, yourself, see on a day-to-day basis, right? And again, I think the messaging has so been linked to, an elimination strategy. Well, guess what? Vaccines are the strategy. And as Suman had said, we can't minimize this, right? Like, these vaccines are incredibly potent. They change the disease process to the individual. They change disease process to society. Israel reported one case of COVID-19 yesterday. One. This was a pandemic that was worse than worse than the United States, at points worse than the United Kingdom. One case. This is what vaccines do, right? Like that, and I think we really do have to not undersell what life is going to look like in 1 to 2 months when these vaccines take hold, when our high-risk populations get vaccine-derived immunity, where their antibodies are maturing, and even the preprint today suggesting that their antibody levels will actually be high, even with a delayed dose strategy. At about 10 weeks, they're going to see higher antibody levels than people who got their second dose, right? And so, there is a lot of hope with these vaccines moving forward. And I 100% agree that exit strategy needs to be put on the table as part of these vaccines maturing in our population.
Yeah. And sorry, go ahead, Heidi.
Yeah, I wanted to jump in on two things. Okay, so I'm going to put on my other secret hat that I wear, which is as a historian, which is to say that epidemics usually don't end, right? There's a wonderful piece by two historians, Jeremy Green and Dora Varga, they wrote last year, which is saying the end of epidemics. And their whole point is basically none of them end. Smallpox was eradicated, which was a miracle, but it also took 200 years, right? Thomas Jefferson was talking about smallpox being eradicated in the 1780s. It took us till 1980 to declare it eradicated. So actually history already tells us that is the lesson, that epidemics end in weird ways where they become endemic, not where we have zero case in the whole world, the eradication version of things. So that's one very quick thing to say. And the other thing I want to say is there's a really super interesting poll out of Angus Reid today that I was looking at before to prepare for this podcast, which shows that actually people's views on vaccines in Canada have been incredibly malleable. And despite the messaging, which I agree has had a whole host of problems, the number of Canadians who want to get a vaccine is going up, 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 up. We're now at 82% of those who were surveyed who said, I want to get a vaccine, or I've already got one and I want to get it ASAP. 6% said, I want to get one, but I'll wait. And so we're talking already 89%, well, 88, I can add, honestly, 88% of those surveyed said, I want to get the vaccine. That is incredible. That is incredible. So I think that's the other messaging we want to have as well, because I'm worried that we spend so much time talking about the tiny group of people who are the militant anti-vaxxers that we're missing the message that, wow, vaccine confidence is just booming. It is incredible to see these numbers. And that's the other thing that gives me actually a lot of confidence in saying an exit strategy is genuinely possible, because the percentage of Canadians who want to get vaccinated is so huge.
Monica?
Yeah, I think we are always talking about hesitant when there are ways to make people want to have the vaccine. And the best way to want to have the vaccine is celebration. Like I keep on thinking about the Roaring 20s that they said it had something to do with World War I, maybe, but did it have anything to do with 1918 being a pandemic and people having to stay away from each other, and how lonely and hard that was? And people really, really miss each other. And also we didn't allow people to see each other because we didn't use harm reduction. We used a, kind of blunt approach. And so if there's these messages in Europe that they have on billboards where everyone's like hugging and like, this is why we're doing it. And they're at a big table eating stuff together. Like, we are so austere. I don't know if it's North America or what, but we're so austere about our messaging. They're like constantly showing what happens after the vaccine is very celebratory.
There's a message actually, Monica, that I'll never forget on I guess it was maybe our second podcast together, where you're like, because I was reluctant to use the term like miracle, like, and I sat with it for a while and I'm like, motherfucker, this is a miracle when you think about it. It was a year when we were sitting on our backsides looking watching TV on our phone saying, what the hell is happening to the world? This is some scary business here. And then we got vaccines. Like, I got mine on January, and I'm like, you couldn't help to get a little emotional when I got it January 1st, and I was like, wow, like, think about what this represents, yo. Like, really think about what this represents. And now we're talking in Canada, about 50% of people got their first dose. You know what I'm saying? Like, this is real. Like, this is like, when I do news spots too, guys, like, now I will use the term like this miraculous. It really is.
We have to use that term because March 11th was the day the pandemic was declared by the World Health Organization. And November 9th was the first press release of a highly effective and safe vaccine. That's not very long. That is a miracle, in my opinion. Yeah.
Zane?
It's funny you mentioned the ads around like people getting together and gathering and they're normal, and like, I don't want to throw shade at Ontario, but they did the complete opposite with those ads, right? They showed the people getting together, having a great time, and then they showed some guy being ventilated in the ICU immediately afterwards and saying COVID is still here, be aware, right? And it's just like, it's such a stark contrast, right? So then it's like, like, it should be a celebratory moment. It gets to your heartstrings. You feel like you're normal, and then you see the ICU, and then you're shell shocked, and you're never going to leave your house again until you have your 2 doses of Pfizer 14 days apart, and maybe you'll go to the grocery store at that point, right? But again, it's just dispelling a messaging here, right? Like it's such a contrast what we've done with our campaign. And don't get me wrong, like COVID is serious. I get it. We all work in hospitals. We've all seen the effects. We've all seen the overload that's been there for the last couple of months. But also we have to assume that people understand that COVID is serious at this point, right? And if it wasn't serious, you've been living under a rock for the last year and a half. And again, people are looking for hope. And that's really the context of all of this, right? And maybe it's not in the places that are tough right now in terms of the hospitals, in terms of healthcare systems. But the average person is just looking to, when can I go out? When can I see my family?
Yeah.
When, why does the government say I can't go outdoors when I couldn't go outdoors before, right? And there's just so much of this lost in all of this where, again, people should feel proud of this miracle that we're living in a generation where you can make a vaccine that's highly effective in 9 months after the declaration of a global pandemic and have that immunization in many people's arms by a year, right? It's just, incredible. And again, to respect it is part of this for sure.
Yeah. And Zane, I think this is part of my fear and the incentive to do this. You're talking about that fear messaging that we experience locally, and it permeates through not only the campaigns, but when our leaders come on the news networks and saying what they're saying. And this is one of my biggest fears actually is when it is quote unquote safe. And we'll talk about what metrics we should be talking about which will equate to safe. But my fear is that even when it is safe, we will still be, masking in playgrounds or, still putting up extra precautions because of that fear-based approach. And so maybe my question let's go with Suman is, what do we think about metrics when it comes to opening? What marks are we looking for not only opening, but even say down the road when we're going to start seeing cases again in the fall? What's the stuff that we need to be looking at?
So Zane knows that I've been chomping at the bit to answer this. Monica, I post about this. It's more annoying than my GIFs that I post the same GIFs all the time. You've seen some of them, I know. Heidi, you've seen those, haven't you? So one thing that I think that in Ontario, actually, I think in all of Canada, is we've been kind of waiting every 10 o'clock in the morning, that case count. I guarantee you, if you stop publishing that case count, the provincial case count, the temperature of the entire society would drop 10 degrees overnight. But the thing is, people have been watching that. And I was mentioning at the very beginning that, look, cases are clearly a metric that was important before, but now things are quote unquote contaminated with vaccine effect now. So you're going to be seeing cases. But what I kind of go back to exactly what Zane said is, why did we do any of this lockdown stuff to begin with? And if you ask the average person, it's to stop COVID. And I said, well, no, it's just to slow down transmission so we don't overwhelm hospital systems. So now if you have something that actually takes a inpatient disease and turns it into an outpatient one, turns it into a common cold, then you could have 1,000 cases, but it's not the same because only a small proportion will get hospitalized, and you don't need to shut down society for that. So that's why my big thing is that I noticed that, and Monica, you actually did mention this just now, is that people are worried about when you start to open up, cases will go up. I try to say, well, they might. I agree, though, vaccines will blunt that. But at the same time, let's say even if you do have 500 extra cases and it's just a sniffle, or people are just at home in bed for a day, who cares? And I think that that's why this whole idea of scaremongering, looking at an aggregate number like the case count and using that as a substitute, like a surrogate for risk, I think is not the right thing to do. So I think the first thing is looking at hospitalizations, which is very, very important. And as we start to see that contract, especially the ICU, which, by the way, is already happening here in Ontario, we should really, really start doing on the roadmap to opening, and just less reliance on the case count and understanding, messaging the fact that this virus hasn't gone anywhere, but we'll be able to deal with this without shutting down the society in the future.
The two words, I have to use these two verbs because I really have been waiting to use my two verbs. One is uncouple, right? So hospitalizations become uncoupled from cases because it's no longer a severe illness if you, my second verb, defang the virus. So I wanted to say uncouple and defang so badly, and now I got to say both of those. So you just defanged a virus. That is, society cannot be closed down for that. And if you publish case count, I keep on thinking the only people who should know next year about how many cases there are is infectious disease and doctors essentially should know how many numbers there are in a society, because if it doesn't make people sick, then why would the general public know case counts?
I'm just wondering how, maybe it might be a tough one, Heidi, but like, how do we message that? Like maybe it's just me being so hyper nervous, just because I actually thought even after the first lockdown, I'm like, I went out saying like, man, we learned we're not going to do this thing, have the same approach. We saw how it affected, everything, from delayed cancer diagnosis, kids, maltreatment, joblessness, poverty, like the whole gamut. I'm like, we must learn. We're not going to do this again. But I was wrong. And so I'm still going to be anxious about how do we message this to either the powers that be, to the people. Like, we can't be focusing on case counts. It has to be uncoupled, if you will.
Yeah, I think it's a big challenge. And I think you pointed to another big challenge, which I know Zane has talked about before as well, which is that we've had a weird lack of learning during this pandemic, right? Like February, March 2020 is a different world where this really was a novel coronavirus, but now this is no longer a novel coronavirus. And so we should be learning from the data that we have with this disease and stop making the analogies with, other diseases. So that's one of the things that I hope we can sort of hammer home is let's finally learn some lessons. And the other thing we can do is learn lessons from other places about how we're messaging around this as well. And that's where I think things like roadmaps are helpful. So Monica talked about the UK roadmap, and I have plenty of criticisms of the way the UK has dealt with COVID. But one thing that was very helpful finally is to have a roadmap. And the other thing that roadmap had was it had tests, right? It had 4 tests about whether you were going to hit those dates or not. Right. And that I think is also helpful because you're starting to sensitize people into, all right, we're not just doing this because it's an arbitrary date of freedom. We actually do have some tests applied to it. And then you can start messaging around exactly what Sumon and Monica were just talking about, right? Here's our exit strategy. Here's what we think we're going to do on these dates. And here are the metrics that we have. And then you can start sensitizing people to this, right? Because it's not going to happen overnight. And I think one of the things, there's a whole spectrum of things I guess we can all worry about. One is opening too slowly. Another is the people who are going to have all sorts of, issues and phobias around seeing other people indoors. There's going to be there's a whole spectrum basically of people who are going to have to deal with returning to a form of normal. So we need to it's going to be a long messaging strategy. But that's one thing I think would help is to start adding some of those tests. So we start talking about why case count is going to matter less at this point, and we talk more about maybe hospitalization. So I think it's going to have to be a bit of a long-term one, and hopefully where public health officials and others who still have a tremendous platform can be tweaking their message at this point. Maybe they're taking Monica's verbs and they're just using them, right? So they've got different slogans at this point than the ones that we had at the beginning of the pandemic.
Yeah, it's a good point because we should have time, right? Like on paper, like with, I'm assuming summer will be like a typical summer, and we'll be dealing with what we need to deal with in the fall. But this gives us time to really get the word out. Say like, let's uncouple like cases when it comes to COVID and really focus on hospitalizations. Monica, were you going to say something? Otherwise, I was going to post a question.
Well, I was going to say, if you don't give people like a roadmap, like the UK did. And yes, you can say maybe things didn't go as well before, but there was this clear like dates that were really fun. Like they actually linked it to fun things like a wedding, or, you know, when you said give it a test, like they actually had 3,000 people in Liverpool, maskless, sweaty, on a dance floor, and nothing happened. 10 to 14 days later, like in cases, nothing went up because they had enough immunity in their population. So they did some like real tests, like Beatles type tests. What happened in this country is that there was a lot of criticism of the CDC saying, by many of us, including me, saying, boy, you're not messaging enough optimism. And I started saying that in February, so a long time before I knew it was going to be this good. But a lot of other people are criticizing them and saying you're being exactly the conversation we're having today, mask and distancing. You're talking about that all the time, even when you've gotten the vaccine. And then they messaged on May 13th, which was just a couple of days ago, okay, you don't have to wear a mask if you're vaccinated. And the United States went crazy. I mean, people were so nervous and so anxious. And some people are like, yeah, that's really reasonable. And I see that you just told me all the data that vaccines are not really profoundly effective. You just told me that out of 115 million Americans who've been vaccinated, there's been one death in a million from COVID when there used to be 586,000 out of 328 million. Like you've just taken away severe disease with vaccines. Really clearly said that at the press conference, this uncoupling has happened. And also you can't spread by all means after you've been vaccinated. So it was safe to say that. It was based on data. But boy, the United States went crazy. Op-ed, like it's only been 4 days and there's been like 20 op-eds written by epidemiologists or infectious disease people saying how nervous they are about this. So we weren't ready if you don't lay it out ahead of time, if you do it kind of all at once. And it'll take people a little time to get used to it and then they'll see it's okay. But so that by not having a roadmap, then now everyone's distrusting the CDC and saying, oh, should they have done it that fast? And I'm like, I think they're just following the science, but it was too abrupt.
Yeah, Monica, if I can say one thing, I forget who it was who posted on Twitter who said they might have been following the science, but they weren't following the social science. And I guess I would say they weren't following the communications messaging, right? And that's why strategy, because that was a tactic. It wasn't a strategy. And so we got to, let's learn this lesson in how we're doing it in the provinces and on the federal level in Canada. We have a lot of time and we need to, be getting that hopeful message out there. The UK gives us one example, but we could talk about others and what are the metrics that make sense here. But that, we can already see what happens when you don't have a strategy and you don't have messaging.
Yes, people start distrusting you and go crazy. And they were so anxious and people thought they were going to be infected. And people were like yelling at me and staying at home and very nervous, and no one left their house for a weekend. That's how nervous they were. So really, it's strategy. That's a great point.
Yeah. And I mean, with all this stuff, sometimes you don't need to recreate the wheel. Look at what's happening throughout other places, even in our own country. We talked about this a long time, like BC being the crown jewel of the way to approach COVID. And it's like all our public health has to do is just look west, see what's happening there, then close down schools. I'm pretty sure they left outdoor activities, right? Yeah. And they're on and then still coming on the better half of this at this time. Know what I'm saying? Zane, you were going to pipe in something?
Yeah, no, I mean, Bonnie Henry left 10 people outdoor gatherings, right? And she said very specifically, we need to support a population even in this wave. The outdoors is low risk. We would rather have people meeting outdoors if they have to, they should do it in that context. We are not going to restrict that to our population. Yes, some outdoor recreation did have to settle down as part of this, but, there was still a focus on having a safe social space outdoors. And, me and Suman and Heidi have talked about this so much, right? I don't understand where our obsession with outdoor transmission started and why it's still ongoing. And again,
it's insane.
It's insane. It's absolutely insane, right? I don't understand why in March of 2020, outdoors was still reasonable. In April, May, June, July, August, September, it was still reasonable. In January, it became unreasonable. And after that, it's basically been off the table, right? and people are doing it, right? So, I think people understand how to keep themselves low risk. They can read, they understand the literature as much as our public health officials to a point. And yet we've made some terrible moves in that, right? Like there's no reason why outdoor amenities, physically distanced outdoor activities, all that stuff should be open right now. And again, our public health officials seem to have tied it with vaccine rates, which doesn't make any sense whatsoever.
I was going to hit, oh my God.
It doesn't make any sense, right? Why does 75% of the population have to have a first dose of vaccine and 20% of the population have to have a second dose of vaccine for me to go hiking?
1984, man.
That's literally what the roadmap says, is I can't hike.
Oh my God.
Okay. That is so, we're still doing this here. Okay. Just as a comment, because we're not any. So right now, children have to be masked outdoors in a playground in a city that has a 0.6% positivity rate with a 76% vaccination rate, San Francisco, but everyone else who's vaccinated can be outdoors without a mask. So, but they're still masking because they're anxious. But honestly, children, so you just said, it's just the biology, right? Like the biology is that it dissipates really quickly, the virus outdoors, study after study after study, that very little outdoor transmission. University of Canterbury said this in their review in September, and they said, actually, you're going to drive people inside if you don't open up the outside. And that's exactly what happened over the holiday season in winter holidays in the US, and things got worse. But to this day, a child has to go mask outdoors right now.
It is.
Yeah.
Like I won't go on my rant yet, but Suma, you were going to say something, but it's probably better because I feel like I'm going to go off. But yeah, Suma, what were you about to throw down?
In terms of messaging, another thing that I think that again, this was new for all of us, but I think that the message that has gone through in Canada, at least, has been almost looking at the public as if they're the problem. I'm part of the public too. So, I remember like in the summertime when things were awesome, we started seeing rises in teenagers and in young, you guys remember that in like August, we started seeing that rise in BC, and the message went out rather than, stay outside, things are okay, hospitals are still okay. It was, well, if you're young, you can still get COVID and get hospitalized and die. I was like, whoa. So I think what's happening now is that we're reaping the seeds that have been sown at the initial part about everybody thinking that every case of COVID is a tragedy, every case of COVID is a disaster. And now what you're seeing is that, so I talk to people with the outdoor stuff is that, I think outdoor is amazing. The first thing I'll get is, well, what about this? What about those 15 kids playing basketball? What happens if one of them breathes on each other, right? And then I think that is, I don't blame people for thinking that, but I think the reason people think that is, number one, they want to eliminate all transmission. And number two is that the overarching theme of what's happening, at least in Peel, Monica, I work in an area called Peel, just out of Toronto, and we have a ton of essential workers, multi-generational households, and it's this huge occupational to household transmission chain. Not a single one of these people that I've seen in the hospital, and they're like 98% of my ward, was at a home sense lineup or was at the park, and I think that aspect of, you can't blame people that work in that situation, but a lot of it was blame-based messaging and abstinence-based messaging, and we're all ID docs here. That doesn't work, and I never saw that change. Maybe the occasional good message here, but that never changed, and it still hasn't changed.
Yeah, I gotta just step in with this outdoor stuff because it's just it gets me so creased, because not only is the data supporting it, not only is it a way of us staying connected, not only is it good for our mental health, not only is it good for our physical health when we see cases in the ICU completely related to inactivity, diabetes, obesity, hypertension. Like, this is what a tremendous opportunity that we could have been preaching outdoor living, and the ability for us to cope and mitigate some of those secondary impacts of COVID and the restrictions could have been dealt with without preaching outdoor living. And the data supports that it's safe. And I'll tell you this much, I have yet to see or hear of an intensive care patient landing in ICU from an outdoor exposure or a home center exposure. You know what I'm saying? Or playing tennis, pickleball.
Never tennis.
No, I'm saying.
By the way, can I ask something? Monica, was it you talking about the inoculum effect?
Yes,
Yeah,
that's her.
I
Yeah.
did talk about the inoculation.
That has to be
I
a
actually
thing.
think it's playing out. It's just that people got so mad at me about that.
We got to
I'm
explain
not
that
mad
to
at you. This
people.
is
And
amazing.
Okay,
That's
I'll
great.
explain
Sorry,
it.
we gotta
But
explain
people
it in,
got so mad. Okay, so the idea was that it seemed as if you used mitigation measures or there was more ventilation that you'd have a milder case. And then we published a paper like in the New England Journal about that said maybe masks are a form of keeping the severity of disease down because you'll get less inoculum and then you won't get as sick. And then we published a paper in Lancet ID that really went over the evidence for this in other infections, because there is a literature in other infections. We don't give challenge experiments with COVID. There is one going on in the UK where they're giving increasing doses of COVID. Eek, but good, like they're doing it. So let's see what happens. But so to see if people get more symptoms. But that's been done with actually influenza and other infections. And it seems like the more you give, the more sick people get. It kind of makes sense. So, but when we put it together, we got yelled at so much. It was kind of this idea that, well, people will then take dangers. They will still be around each other. And that was actually that was our point, that abstinence-based is a terrible thing to do to people. We know this from sexual health and HIV and infectious disease, but it was terrible to tell people to stay away from each other when we could have told people to be outside or different ways to keep safe. It was really inhuman and truly inhuman. Actually, it's not human to not be around each other. But we got really blamed by public health messengers that, and I keep on thinking, well, you're not an ID person. I know that's so snotty, but you're not an infectious disease person who would maybe think of this. And so then this just actually played out in India. I think it is playing out in India that when there's so much exposure, people between first and second doses are getting mild infections because it does overwhelm the in the nose. I think if you're getting a lot of exposure, like healthcare workers, but that's the more reason to be really, really protected in the healthcare setting, and also clearly bring down cases in India. I mean, it's terrible what's happening in South Asia. So that is, the inoculum effect got politicized, and it got politicized that we may be telling people that COVID is a mild infection of COVID is okay. And that got really politicized.
Yeah, I mean, I can't overall believe how much all of COVID's been politicized. It's
really politicized.
I hate to be blunt like this, but it's literally affected lives. It really has.
There'll be so many history books to write, Heidi. So many.
Oh, yes. I'm already at work on my history and policy book around this.
So much
but there's,
work, yeah.
There's a lot of things to say about that. And I would, the only thing I was going to say is, I've had such a different experience in many ways of living through this pandemic in BC, where Bonnie Henry has often had to face the ire of people who wanted her to close everything outdoors. And to her credit, I remember even last summer, to her credit, saying no. And one of her slogans was fewer faces, outdoor spaces, right? And there was a moment last fall when everything is getting shut down inside. But she maintained the 10 people outside. And again, there was a lot of pushback in there. She's saying, no, this is really incredibly important. But I think that's just to contextualize, somebody who stuck with that message had to face a lot of pushback. And I don't think it was easy. It was the right thing to do, right? If we look at the numbers and we think about that, the whole context of it. And also, BC has such a mild winter that it's reasonable that people could actually be going for a walk outside in December. But it's a good example that it was possible, but it did require, I think, a lot of steel backbone on her part, because there was a huge,
it's so hard to be
it is hard, and there was a huge amount of, I think, pushback on her, but to her credit, she really stood her ground on that, and I think it's made a huge difference to everybody's mental health in this province, that we have still been able to be outside and to do things that are so low risk as to be called safe.
Do you guys think so our prime minister, they were using, you alluded to this too, Zane, this 75% vaccinated, needing 75% of Canadians to get their first dose for us to gather outdoors safely. I think I know the answer to this, but number one, where's that coming from? And number two, the what was I going to say? True. Oh, that I think Suman, you got that expression he was using: 1 dose summer, 2 dose fall, or some shit like that. Like what is this? What is it? What's the basis of this? And is any of it, as far as we could tell, based on science, or is this more political craftry? That's not a word, but I just made it up.
So I think where the worry is that you let this, living under a restricted lifestyle, the reproductive rate is much lower. And so, once you open up, then you then introduce a higher reproductive rate. And fine, it may happen. And I guess the modeling from a few weeks ago from the Public Health Agency of Canada was, okay, when you're kind of getting to that 75-25 number, then even if you do see a surge, it's not going to necessarily affect healthcare as much. But they used a lot of assumptions and talking about 60% vaccine efficacy, which is probably much, much, much understated. Again, you have to use what's happening in the world, right? Yes, I think Canada is unique in the sense that we've had a lot of shielding in the pandemic and there's no natural immunity within the population outside of some regions of Canada, like where Suman and I are, or in some areas of Toronto and some areas of Calgary and Quebec. But there is still something to be said about what mass vaccine does in terms of changing transmission dynamics. There's still something incredible to be said about what mass vaccination does to reducing hospitalizations. And, the data that was published from Public Health Ontario with a 1-dose strategy is incredible. Of 3.5 million doses of vaccine administered, all 3 types, Pfizer, Moderna, AstraZeneca, Covishield, 0.06% had symptomatic COVID-19 14 days after a single dose, 0.0004% were hospitalized, 0.0001% died. That's after a single dose of vaccine and waiting 14 days.
Wow. No, that's...
And you remember our rollout was age-based, right? So, the people that got vaccinated first are the older people that were the highest risk, even if they had a breakthrough case, of ending up in ICU and dying. And even in that context, you see, decimal points of numbers, right? And it gives me a lot of pause. I don't want to be one of these people saying, it's influenza. But at some point with vaccines, it becomes becomes defanged, as Monica likes to say. It becomes a less virulent disease than influenza, right? And I think this is the part that I think a lot of people are uncomfortable with messaging. Rightfully so, our ICUs are filled. And if you're wrong about it, then clearly we're going to deal with a healthcare disaster. But I think we're seeing in Israel, we're seeing in England, we're seeing in the United States, cases going the wrong way, right? I remember seeing a quote from, I'm not going to say who this famous internist that posted online about the 4th wave in the United States, right? Or the 5th wave, whatever wave you guys are on. But like in January and February, talking about when cases started going down and things started opening up, like predicting this like monster surge of B117 and other variants in March and April. And the US is going to be in a worse position than ever was before. And, again, there are people I was just looking right now at the Carolina Hurricanes game, like a full stadium, right? Like, at some point, the natural experiment, I know, the natural experiment of how good these vaccines are placed in the population in terms of interrupting transmission dynamics. Yes, we're living with a 1-dose summer and whatever the hell that means. But even in the UK, right, they're showing that even that is probably still effective moving forward, right? Doesn't mean we give up on the vaccines, doesn't mean we stop vaccinating people, but I think we got to respect what even 1 dose does to people, right? It is incredible. And we're seeing this in reality, right? I mean, Suman, I don't think I've seen a handful of patients, I think, over the last month that have been 14 days out from their first vaccine that have ended up in hospital. And the vast majority of them have had some major immunocompromising state where the first dose may not have given them the immunity that they would like in that sense. We're never going to count those cases that never showed up to the hospital that should be in hospital. Monica, our biggest thing in the first 2 waves was our long-term care homes were disastrous. They were death zones, right? You would lose 40 people in a week in a long-term care facility. The first vaccines in Canada went there, and they literally have turned off cases.
It's been incredible.
It's just incredible, actually. Right? Like the highest risk environment, you have 80 times the risk as an 80-year-old in long-term care as compared to an 80-year-old in the community of dying of COVID-19. And it just turned off immediately, right? That's how powerful these vaccines are. And I think we underestimate even what one dose does in that population.
Yeah, no, I think, yeah, no, there's the long-term care example is so beautiful, and everyone recognizes it too. Like when you say, hey, look at our long-term care numbers, when we talk about efficacy of our vaccines, it's like there's no doubt, and Monica, if you're talking to us, you're on mute. I wasn't sure if you're talking. No, she looks like she might be on somebody. No, it's okay. Sorry. But what I was going to say was, in terms of kind of talking about a roadmap, we'll take questions in the next 10 minutes or so. But in terms of roadmap, so like I'm gonna use Ontario as an example. We're pretty restrictive, and we have a stay-at-home order right now, whatever that, and so what? Maybe we'll go with Suman. What would you feel comfortable now or soon in terms of restrictions lifting off? And then if you feel like it, we could add schools in there too, my friend.
Okay, I'm going to get hate for this. So I think that we all agree that the outdoors should be opened up. Just opened up, and I think within reason, although I don't even really think that makes much of a difference in terms of you don't want like a sky dome full of people, but I think having a crowd outside, it just has the trade-off, I think is good for me. So number one. Number two, patio dining. I think that would be quite helpful. I know people talk about mobility. Zain, I'm going to let you make your point because I love this point so much. So I'll leave the mobility aspect to you because it's different now. And I think that, low risk retail, like just having retail open back up for, limited things, and especially for our small businesses. I sound funny when I say that, but I'm from a small town. I have multiple friends who their businesses have been decimated. And of course that has an effect on their life. And I think that that's one thing that we can certainly help people to be able to deal with. In terms of once you start to get into the higher risk things like, things where there's larger groups inside, I understand holding off on them today, May the 17th. We still do want to see some decompression in our ICUs and hospital. But that said, we also have to remember that it's different now than it was even 2 months ago. Further to what Zain said is that with how effective the vaccine is, you're not going to have this virus rip through the population like it did even with B117. So I think that we have to remember that we've now protected our elderly community living people. We've protected we're in the midst of protecting the hot spots. So a lot of things are different. So I can understand waiting for certain things, but I don't think we should wait too long. I think in June, we should have a significant plan of opening things up in steps, roadmap. And the other thing that, by the way, Heidi, you never mentioned this, but I think it was the case in UK. All of the checkpoints for opening up, they were all one way, right? They made didn't they make a point of saying that it was one way, that they would never go back? And I think that was also a kind of a pretty good thing, I think.
Zain, your example?
Yeah, I mean, I love the idea of the same thing as the UK, right? Give tests. Say, you know what, like we have to be under 1,000 cases, and our healthcare system has to be functioning before we do X, right? And again, go in that direction. If you don't get to that by June 1st, then you know what, it goes down the shelf for a couple of weeks. Everyone understands that's the objective, but that's fine. At least we know in that context. I think the obsession with mobility markers was something that was completely taken out of context in this wave. in January or December of 2020, when we dealt with our worst part of COVID-19, probably, towards everyone in terms of long-term care as well as in individuals, mobility was a reasonable marker, I think. You have, people going to other people's establishments, people going to malls, people going into high risk, dining, going into higher risk settings. And the fact that it was -20 outside probably didn't mean that mobility was going into places like the outdoors. Well, it's May 17th, 2021. It's, right now it was 25 degrees outside today, and everything else is closed. Schools are closed, restaurants are closed, malls are closed. Everything indoors is essentially closed, other than I'm sure people are not going in droves to grocery stores to hang out and socialize. At some point, that mobility really is people that essentially can't do anything but work, like essential workers, and you're never going to knock down that mobility because, that's our facets of society that need to survive. And it's people going outdoors. At some point, that mobility becomes such a bland marker because people going outdoors aren't going to be the ones responsible for epidemic waves, right? Yeah, you don't want the gathering of Skydome or 100 people outdoors having a party, but the 10 people gathering outdoors by the limits, having a picnic in the park while socially distanced, is that mobility really contributing to a negative goal here? No, absolutely not, right? And I think the third benchmark, and I feel like I've been a broken record for, everywhere from December to now, right? We have still not dealt with the workplace safety issue as well as we could. As much as we, want the pandemic to end and we want the drivers of transmission to end with vaccines, which, thankfully it gives us a solution, we still, are putting people at risk going to workplaces, right? We're still putting people at risk, by, not incentivizing them to get tested, by, putting them in precarious work situations where taking a day off may be fiscally unstable, where new Canadians that probably can't apply for, any type of these random plans that we have in terms of sick day leave and the sickness response benefit, can't or don't even have a window to access it, where new Canadians that are being paid under the table are going to be fiscally unstable. We knew that was the driver of transmission wave 1 or wave 2. We knew that was the driver of transmission going into wave 3. I mean, we all saw that in terms of the people that were hospitalized as part of this wave. And we're still sitting here debating about the outdoors, where that's the setting, right? And we thought, okay, we'll dump vaccines into that place. Fine, that's something. But it's not everything by any means, right? We got to still deal with that component as part of a reopening plan. And I really, I think it fell out of favor to say, okay, we're going to go vaccinate Amazon. That's going to fix the problem. But it's something we're going to have to deal with. And even with second doses, I think I've taken a lot of hate saying that, maybe we should actually be deploying our second doses into those places of people that can't work from home as compared to, all the people that are, able to shelter in place and wait a little bit longer for their second vaccine, right? And yeah, I mean, I think there's still that part of benchmark of reopening that we really haven't solved as well as we should. And I think as part of the plan moving forward, it needs to be on the table as well.
Maybe, Zane, if I can jump in just with a messaging question. As the one doctor who doesn't have to work with other humans, I'm still waiting for my first dose, and I'm okay to wait. Right. And I think that's another message, right? It's not my turn yet. I have the incredible privilege of being able to do all my work through a script. I haven't seen another one of my work colleagues to do a work thing since March of 2020. And that's okay, because I can wait for a vaccine, right? And I think that's part of the message, right? It's also, how do we deploy this in a way that actually accords with where the infections are and who are the people where it's okay to wait? I am so excited to get this shot on May 27th, but I'm also really happy that other people who needed it more than I do got it first, right? So that's hopefully a way that we can also talk about this conversation. Like, we all want to get out of this, and hopefully, despite banging the same drum for a lot of time, maybe there are some messages where we can really, really bang this home by those of us who are waiting, saying, I'm okay to wait, because there really are people who are essential workers and others who frankly need their second dose first more than I do.
No, that's a great way of framing that, Heidi. I apologize, Monica. I had to jump off for a second there, but I was gonna either save it for Monica later, or if any of the panelists felt strongly, where do you feel schools should, in terms of reopening, should come into any of this aspect? I don't want to put anybody on the spot, and if they don't, Suman, you're the first time.
I've taken the hit a couple of times on the school thing. So I think that clearly this is an issue that we want to really look at the big picture. I think that we all agree that in-person schooling is very important for kids for multiple reasons: mental health, physical health, development, social development. And, we were hearing a lot of things, and I was one of those people who joined in it, where it should be the last to close and the first to open. I think the first aspect did ring true. It was the last to close, but it hasn't been the first to open. And then sometimes people are saying, well, there's only 6 weeks of class left. Well, those 6 weeks, for those kids being back, I think would be really, really important. So, at the time when we were at the peak of our third wave, there was just so much community transmission that the school ends up being something that can act as just further transmission, and that exacerbates an already bad situation. But I think that we are already down to a point where the trajectory of our wave here in Ontario has reduced and is reducing. Okay, that I think that we really should consider opening schools back up again, even in a hotspot like Peel, especially with where the vaccine coverage has been, the trajectory, and the trade-off of just how much benefit kids get from being back in school. I can feel the tomatoes coming at me right now, but I think that's really important to convey, because there are just so much. I think we've had a laser focus on COVID, and now this is one of the biggest things that we need to do to show where the benefit lies in kids being together. Yeah,
I mean, I know you feel like the tomatoes are, but I feel like there would be a lot of parents that are sitting there clapping for you. But honestly, fully understand you're in a hot spot. You can't even staff the place if you're having that much COVID in the community. But man, it's time. And as far as I'm concerned, the kids have suffered long enough. This is, they're learning on virtual platforms, which have never been validated. We don't know the impact of that. We know child abuse goes up. We know, it's impacting their mental health, their well-being. These are our kids. And so when we have that first glimpse of safety, this is the time as far as I'm concerned. Okay. I'm going to throw down some of the questions. We're going to do this for the next 20 minutes real quick. I'm going to go to Zane for the first one. What are your projections for the fall? Do you think another lockdown is possible?
This is where metrics come in, right? What do we want to see in the fall? Well, we're not going to eradicate COVID, right? That's not what we're going to see in the fall. Even with the vaccine campaign and whatever this 1 dose, 2 dose fall is going to be, what we hope is come to the fall, our hospitals aren't going to get overwhelmed, or, you're going to see the reasonable case activity that you'd see that leads to respiratory virus admissions as part of our normal milieu, right? The reality of the situation, though, is I think we have to be wary of is the way we test for COVID-19 is probably not going to be the same in July or August of 2021 when people are getting their vaccines, right? No one's going to go to a testing center when they have a sniffle or a headache when they're fully vaccinated, right? Maybe in certain settings like healthcare or long-term care or high-risk environments. But, the way we do all these case monitoring and case and contact tracing in the community is going to fundamentally change, because people aren't, we did this intensive case finding again as an adjunct to slow down transmission so that we don't see healthcare becoming overwhelmed. These vaccines, again, with a fully vaccinated individual, their risk of hospitalization is lightning odds, right? And the risk of death from that hospitalization is even more lightning odds. And so, yeah, I mean, I can't see, if the benchmark is hospitalizations from a respiratory infection, that a lockdown is possible, right? And again, I don't think people are going to be tested the same way they are in September, October, November. So we'll only probably get the marker of what's going on in our communities because of what's happening in our hospitals more than anything else. Are there going to be hospitalizations? Yeah, I can't say they're not, right? They're going to be people that don't make an effective response to the vaccine, that break through the vaccine, that develop disorders that again make the vaccine ineffective. And that's reasonably expected. But is it going to lead to all the downstream effects of shutting down society and financial and fiscal and childhood instability? Probably not, unless hospitals are completely overwhelmed again.
Can I add one quick thing to that? This is, in speaking to the federal guidelines that came out, this is one of the things that really scares me about those guidelines, which I don't think they're going to follow, to be honest with you. They're very vague, but they talk about the one dose, whatever, and then 2-dose fall, right? And the thing is that if we have ongoing testing, there's going to be a natural increase in cases in the fall, like you expect when people are, in schools, and that's when, if you have an ongoing lockdown through the summer without a plan, as Heidi, you mentioned multiple times, all of a sudden you're going to be faced with these cases going up, and they're just going to want to keep the lockdown, right? Because there's a fundamental misunderstanding of what's actually happening. So I would actually go on a limb to say I don't think there will ever be another lockdown, because because of the hospitals being able to handle any relatively small load that we get, that we are able to deal with influenza, and we will deal with it in the coming week.
I would certainly hope you're right, Suman. I think the follow-up question, the next question answers that too. You guys correct me if you feel like I'm wrong here. I'm wondering what metrics will be for a full school reopening in the fall. I'm worried that for our children, I hope they have a regular school year without mass distancing. They've lost so much already. Out of my opinion would be the same metrics of hospitalizations in terms of deciding on school opening, especially if it's the first one to open, last one to close approach. Let me know if anyone disagrees or wants to comment. Otherwise, I'm going on. What about variants of concern and the possible need for seasonal or subsequent vaccinations beyond the second dose? Any takers? I don't like putting you on the spot, but if you volunteer, Zane, there you go.
Variants of concern have been around. I think we're hearing more and more about them. To date, outside of efficacy for AstraZeneca for the variant first described in South Africa, which weirdly doesn't want to actually transmit very much. It seems to be this very unfit virus where it's not actually represented on the global scale very much. It shows up in small clusters. It's able to kind of sustain, but it's not able to grow outside of what happened in South Africa. Regardless, that one showed some ineffectiveness for mild COVID-19. There are animal models likely suggesting that it is probably fine for severe COVID-19 in AstraZeneca. Outside of that one example, a full series of vaccine seems to have effects against every single one of these variants in terms of transmission, in terms of symptomatic COVID-19, and significant effects in terms of hospitalization and death. And so, yes, is there a potential for a vaccine, immune escape variant to emerge? Potentially, although, again, from a virology standpoint and people that have dealt with HIV, as you get more mutations to things like drugs, viral fitness is actually a cost to all of this, right? And so, immune escape isn't as simple as you're going to have a super variant that can infect everyone and get through the vaccine without necessarily compromising something in terms of viral fitness at that point. It's a small genome virus. There's only so much it can do in one single swoop. So again, I think, the variants of concern, the solution is vaccines. And I think, myself and Monica have been pretty also aggressive in talking about vaccine equity as part of a vaccine approach. Are the two major variants of concern now that are seeming to scare most people are the ones derived from India. that's our fault. That's us saying that, being global hoarders is going to save us from this pandemic, without looking at vaccine equity, right? And there are places in the world with huge numbers of cases, huge numbers of immunocompromised individuals, where these variants are going to escape over and over and over again, right? And if we don't actually take that global equity focus, we're going to be left with the same problem with the new variant here and there and everywhere, right? So again, if you want to do something about the variants, put pressure on our politicians. President Biden today did the right thing, donating 80 million doses of vaccine to COVAX in the developing world. That's what we need to do to stop variants from emerging. But I think, in the grand context, our vaccines are still effective. I don't think we're going to need boosters for quite some time, knowing how profoundly they affect B cells and T cells. Our solution to variants isn't necessarily more vaccines for us. It's more vaccines for the world in that sense.
Monica, would you say you like T cells?
I mean, the thing is, actually, this is really interesting what happened with this variant story in a way, because it was that, if you treat HIV, so that would be any infectious disease doctor, it's not like you don't think about T cells every second of every day, because T cells are the actual cell that HIV infects. And so then the press got a hold of the word variant, and so did some scientists who didn't have as much experience, I think, with immunology, and just looked at the antibodies against a virus, which are over here, and they're just the tip of the iceberg in terms of how we fight viral infections, and didn't think about T cell responses, which are actually the best way to fight viruses in the human body. And T cells, if you have low T cells, it's why you can have severe viral infections like people living with HIV. And so, it's very hard to evade T cell immunity from any of these variants. And T cell immunity is very complex, and you have to measure it in special labs. So maybe it was harder to talk about it. But variants, it's exactly right. What you said, both of you, Zain and Saman, like, you can't mutate yourself out of existence. I mean, you can't keep on getting mutations because something that will make you more transmissible as a virus will hurt you in other ways because it does have a cost. So the best thing that we can do to get through this pandemic is get any vaccines that we're not using. And I really do appreciate President Biden, what he said today, but we have more than he is giving, because the Duke Research Center actually went ahead and just calculated exactly how many doses that we have in surplus, even if 12 to 15-year-olds are vaccinated here, and it's 300 million. So they calculate it very carefully. Actually tweeted this today. So we do have more than 70, 80 to give. We have we can go ahead and give those 220 million doses to places where literally hospitalizations and deaths are occurring when they don't have to occur, because vaccines are the solution. I mean, one thing that pains me about India is that India and South Africa went to the World Trade Organization in October, and they said, can we use that TRIPS patent? Can we make sure that we get vaccines? Because we hear they're just about to declare that on November 9th that Pfizer had a good vaccine. And the World Trade Organization said no. They said no. And so, and then March 5th was when that cases started going up in India. And it was that day that the big pharmaceutical companies wrote a letter to President Biden and said, this is an unfortunate proposal by India, this whole, like, give them vaccines, let's not do that. And so we could have averted, if those vaccines had been there, we could have averted this pain and suffering, a lot of this pain and suffering. So there is nothing to be done but vaccinate the world, and not 2022 and not 2023, this year.
I mean, it's tragic what's happening, but I think that messaging of you want to manage this variance talk, vaccinate the world. You know what I'm saying? And knowing that things are so effective after you're fully vaccinated, you know, there really isn't, there's incentive there to not only from just to being like a human being, you know what I'm saying? Like when you know people are experience unnecessary harms, but you know, it will directly impact us all eventually. Wow. Okay. there's a few questions regarding basically to summarize a few of the questions. When can we, what do you think, like when people are fully vaccinated, what should they be allowed to do? Like, I guess it's kind of a hard question. I'll start with this. Should fully vaccinated people be allowed to do certain things like indoor gatherings before the others? If so, how would we message and or monitor that? Do you see a role for vaccine passports domestically? Zane, you're unmuted, but I think you're already unmuted.
I can talk if you want. Yeah. I think right now there's an optics issue in Canada because people can't access the second dose unless they're a healthcare worker and long-term care have a significant number of underlying conditions. It's hard to then say, okay, you privileged people can go hang out together, right? It's a bit of Hunger Games to say, okay, well, I want a second dose because I can, right? So, I think it certainly is a tool to pull in June and July to start actually pulling that out and saying, okay, you're fully vaccinated, you can get together now, right? And to get people, as we know, because there's a bit of chaos getting that first dose in, get people into their second dose to say, okay, here's your carrot, right? Like the rules change for you in a couple of weeks. And I think the CDC, as much as Monica probably has taken a ton of flack for this, that's part of the carrot, right? Like that is the carrot, right? Like there is a purposeful decision by the CDC to release this right now when vaccine rates are slowing down in the United States, where people are trying to use things like lotteries and sports events and whatever to vaccinate people, to throw people another carrot and say, your life is going to change in 5 weeks now. Start your vaccine series now, right? So, I think there's definitely a role for it. It's just hard with the optics of the fact that in Canada, people can't get a second dose right now, right? And hopefully again in June and July that can get pulled and that string can get pulled to get people back in for their second dose.
If I can be devil's advocate to that, though, is that I think that I get it that we're in a transition period where some people are vaccinated, some aren't, but there has to be some concession given to somebody who has been vaccinated, especially knowing just how effective the first dose is. By the way, Jane, I know that's not what you're saying. I totally get that you're not underselling the vaccine, but at some point, I think that even if it's like public health, the way that I look at it, it's not telling you what to do. It's kind of giving you a framework of what's safe, right? So the thing is that, of course, we don't want like a whole bunch of people, 30 people getting indoors and having a Sangeet night, which, by the way, Monica, here in Brampton or in Peel where I am, it was the biggest cause of super spreader events. Remember Zane in the summertime?
I'm Punjabi, so I mean, yeah, I don't know if you know that, but go ahead. Okay.
Yeah. Anyway, but the point is that I think that if you maybe not now today, but as May starts to roll around, as June starts to roll in, you give people that, look, if you are vaccinated with 2 doses and you're hanging around with the majority vaccinated people, and then, you give risk factors, for example, if you have any health conditions or you're on cancer chemotherapy, and then allow people to make their own risk assessment and be together, as opposed to don't hang out, as opposed to don't get on the beach and have an amazing party at Cherry Beach this weekend. I don't know if you guys saw that. That looked fun. Not that I was there, but anyway, again, it dates back to the whole abstinence thing. But I really do think that as part of the roadmap, we should be telling people what happens when you get 1 dose of vaccine or 2 doses of vaccine and the types of safe things you can do.
So I think if I can jump in, back and the way that we even met in the first place was through the report I wrote about, how 9 countries communicated around COVID in the first 6 months of COVID. And I developed this rapid framework, right, which was a bunch of acronyms. And the R was rely on autonomy, not orders, which obviously unfolds with all of the kinds of things we've been talking about, avoiding abstinence-based messaging, avoiding stigma, etc. So this is exactly that point of giving people tools, give people some air, let them know where the boundaries are and enable them to make choices within that, right? So it's this principle of you can meet outside, right? Giving people those outlets. And so I think, that debate about how do we deal with this vaccinated, unvaccinated? Looking at it through the lens, the US is a complicated place due to the politicization of the vaccine and the fact that a lot of people are sort of using this as a tool to say they're going to pretend to be vaccinated. So I think there's some US context to the CDC stuff that doesn't quite apply in the same way. In Canada, which I would say with very broad brushstrokes, having lived in both places, there is a bit of a different philosophy to how Canadian society works. This is very broad brushstrokes, but there is a kind of wait your turn sense here that I think one could play on if we communicate well about the metrics. So, the CDC version of things has gone down a bit of an individualistic path, right? Like it depends on, are you vaccinated or not? You have to kind of police yourself. And that's, I think, opened some complex doors in the US that I think in Canada, what if we have different metrics? So I was a bit where I think PHAC was trying to go with this 75%, 20%. But that may be an easier thing to deal with because I'm thinking about, and another way to think about this is, then you get into this world of, it really is a kind of consent world because people are going to have very different levels of comfort. Like I know some people where it does not matter if they have 2 doses. If there is 1 case of COVID in all of Canada, they don't want to go with you indoors. So actually the point, because they have real fears and, they have real phobias that have developed over COVID. So that actually a part of it is going to be almost like consent, right? Like what are people willing to do? So I guess my sort of 2 cents would be, let's give people that room for autonomy. Maybe let's tie it to more collective metrics to avoid some of the game playing that I think is going to cause tension in the US. And then we're going to have to recognize individuals. There's going to be a kind of consent basis to this because all of us are going to know people in our lives who are truly scared of being with others indoors, even if everybody is vaccinated. And it's going to take some time for them. And that's also okay, that we maybe don't need to push them too hard because they're going to get there. They're just going to need a bit of time.
One thing I would say is doctors usually message like based in a very nuanced way, in a very like risk-based way. You can eat this on Thanksgiving. Of course, you can have dessert on Thanksgiving, even if you're diabetic. I think sometimes the messengers are not people who sit and talk with people about risk every day.
I do think, I want to talk about a little bit about the risks assessment with Monica, but first, I was recently in the ICU and where we sit at a distance when we give handover with our residents, everyone's 6 feet apart or whatever. And the resident was drinking coffee, put his mask down and he apologized for putting his mask down to drink coffee. And I'm like, let's get real here. We all got our 2 doses and we're sitting around like you could put your mask down to have a drink of coffee. So what I'm segueing into, Monica, is, I don't think people really have an idea of what their true risk is, whether they are vaccinated, whether it's a child, whether, like I saw one of your tweets, was it yesterday or the day before about getting hit by lightning versus somebody dying of COVID, or a vaccinated person?
It's higher to be hit by lightning than dying of COVID after you get vaccinated, and it's higher by about 5 times. So, but that risk idea, you're so right. We haven't incorporated that, like children being lower risk seems to be a very strange thing to say, and yet it's epidemiologically a controversial thing to say, but there's no controversy about it. Like children are at lower risk, and thus our school closures were more for adults than for children. And today I do need to mention that finally, it's terrible, but California's suicide rate among young people did go up last year compared to 2019. And this was the thing that we were hoping wouldn't happen. So school closures, we all on this call understood that we sacrifice children in our school closures, but they are at lower risk, and it's just a fact. It's just a fact, right? And so that stratification of risk, why we stopped thinking about risk, because we scared people so much. We made them think that every single person next to you in a store has COVID. And that not only that, but if you get COVID, you will definitely die. And that's how we messaged to keep people away from each other. And then it's hard to get out of that message, which is why the mask guidance in the United States was met with so much resistance over the last 3 days. People are so scared.
And yeah, because there was a question in there, and a lot of questions tied to risk, like, can my child, if we got one vaccine or one dose and I want to hug my grandkids, or my grandkids want, my parents want to hug their grandkids. Like, is that okay? And once again, it's risk assessment. Like, obviously when you've been vaccinated, and you're dealing with kids, it's low, but do you have a comorbid condition? Or you have COPD? Do you have, are you on a immunocompromising medication? Like, it's all part of the equation. But ultimately, when you factor in a lot of these things, as more and more of us are getting vaccinated, the safer and safer these gestures and these being together is becoming safer and safer. I'm cognizant of the time. I know there's a lot of questions out there. I do want to say, if there's any, I just want to leave any opportunity, if there was any parting words that anybody felt strongly about. And if there isn't, I'm talking slowly just in case. Yes, Heidi.
I had one, which is, I think, Monica is right. This point of the fear basis, and now we're in a bit of a situation of how do you get out and how do we risk message? So, there is an entire center at Cambridge around risk communication, because humans are very bad at it. We're just really bad. The obvious example that we all know. Now the other one for me is going to be lightning versus dying of COVID if you're fully vaccinated. The other one is, so many more people are scared of flying in a plane than driving in a car, even though statistically driving in a car is much, much more dangerous. So, we actually have really good science on how to do good risk communication. It's been a tragedy that we haven't implemented it during this pandemic, but we still have a chance to do it now, right? This is not over. Let's implement what we know from the Winton Center, et cetera. Let's do it now. One other thing we can do is we can stop talking about risk like it's a light switch, it's a dial, right? It's a notch up, notch down. And I hope we can start talking about it like that as well, because people, I think, have really conceived of the COVID risk as like a light switch. Either it's on or it's off, but it's actually a dial, right? So maybe we can start using some better metaphors to talk about this as well, to give people the tools to understand where we're heading.
Brilliant. I like that a lot. And I mean, this might seem random, but it's 2021. There should be an app you could just plug in a couple parameters in, using a little bit of AI. It's saying like where you live, you wouldn't even have to plug in that much. Maybe even just put in your age and a bit of your demographic, and be able to spit out a risk calculator in terms of really what you need to worry about. Yeah, you've been vaccinated, what date, and so forth. And do you have these comorbidities? Maybe people would be maybe they're too fearful that people would be too liberal with that kind of information, but I don't know. I'm a big fan of giving people having faith in the people. Like, people aren't stupid. And I think, we do have to give them a bit of credibility here. But anyways, guys, I want to thank you. Audience, if you missed out on this, type in news and EWS. If you want to get the audio or the video, type in SW if you want to be part of the movement, Solving Wellness. But I got to give mad love. Heidi, Zane, Suman, Monica, and little Elroy. I don't know who that doggy is. Frodo. He looks like Frodo.
Oh, so cute.
Mad props, guys, because this is what we call it changing the boogie on the show. We take the problems, we hear the voices of the people, and we address it full on. And you guys, this was a tremendous conversation. I know it's gonna. I feel like it's gonna mold the conversation within our country.
Mountains in Canada.
Yeah, like it's hard to ignore this. It's hard to ignore when you got these minds coming together and advocating in this way. So thank you. And you guys stay safe. We really appreciate you guys taking the time. It meant the world to us.
Thank you.
Thanks, everyone. Take care. Be safe.
Thank you.
And get vaccinated.